Hello. Thank you so much for joining me. My name is Dr. Angela Lambert, and I want to share with you a story about a woman who I was working with recently who has been dealing with ovarian cancer. And she had a recent diagnosis and had had her first chemotherapy treatment, was really struggling with moving forward and how to make a decision around what to do next. She did not respond well to her treatment, and the doctors were telling her that these were her only choices. And we spent a lot of time talking about how important it is for her to feel really confident and clear about the choices that she was making for her health. And from that conversation, I was inspired to really share with women how to do this. After working with women for 30 years in healthcare, I have seen this same type of scenario happen over and over, where women feel unsure about how to move forward and make the choices that they want. They feel unheard. So I decided to do a presentation to encourage women to know how to do these things better. So thank you. So I have a few goals I want to accomplish today. I'm going to start and talk about how do you identify and evaluate that you have a chronic health problem, how to decide if that problem is limiting your life, what it means to be fully awake versus being asleep with your health. What is the goal you have with your health? What is the role you have with your health? How committed are you? What are you willing to do? What are you not willing to do? I want to talk about what temperament means in relation to health, how to determine treatment options that are available, and how to choose those for yourself, how to really create a successful plan, and how to learn more at the end. And at the end of this presentation, I have an exciting new offer to share for those who really would like to learn more. It's called the Take Back Your Health program. It's a 6-week program to support you on that path of really being in charge of your health. So my name is Dr. Angela Lambert again. I have been a music teacher and a music therapist, where I learned that music can really create change in people's lives. I've been a massage therapist, where I learned that the body holds on to memories. I'm a sacred facilitator intern. I've been a practicing classical 5 elements acupuncturist and naturopathic doctor for many years. This is my dog Lola and I on the beach, one of our favorite places to be. So my story begins actually, and it's important to understand who I am. My story begins all the way back in 4th grade. I went to school one day, came home, and my parents called me into the living room where you had your talks. And they said, well, the principal called and said that you had been in to see him today. And I was a pretty well-behaved child. And I said, yes. And they said, what happened? I said, well, my friend and I really feel like the teacher is treating the boys differently than the girls. And we wanted to talk to the principal about what we could do about that. And my parents said to me, well, why didn't you come to us about this issue? And I said, well, it's not really your problem. So I think we knew from a pretty young age that I was going to stand up for what was right. So fast forward to age 16, and I went to Morocco to do an exchange program. And when I was getting ready to leave for Morocco, people asked me, what do you hope to learn? And I said, I really hope to learn to appreciate the physical comforts I have living in America. Well, what happened was I learned that those physical comforts actually weren't as important to me, but my freedom as a woman was powerful. And to learn that at 16 was really life-changing. At the same time, I was also a very talented musician. That was my talent. I could pick up almost any instrument and learn how to play it. But what was really even more powerful for me was I learned that music can really change how a person feels. And I learned that when I was working with a developmentally delayed boy who was mute. And when he would be agitated, he was unable to communicate with me. So I would start to sing to him or play my flute for him, and I watched him change. So I learned that we could really change things, how we felt, by listening to music. So I went on to become a music therapist and music teacher. And then I went on to become a massage therapist. And then in my mid-20s, I had my own health crisis. And my dad was really into alternative medicine, and he recommended that I go see a naturopathic doctor. I didn't even know what that was. And so I did. And through the course of that process, and it was several months long, I learned so much about how to take control of my own health, like what I could do to make a difference in my health. And I finished that experience and I turned around and said, people need to know that there are other choices. And eventually I decided to go to medical school at age 30. I decided it was time to learn more. So I had to do science prerequisites because I was a music major in undergrad. So I had a lot of science to catch up on. So it took a couple of years of science classes. And then it was 6 years of medical school, and I graduated when I was 38. Practiced out west in Oregon for 7 years, and then I decided to move back to New Hampshire. And when I was getting ready to come home, my business coach said to me, well, you're going to have to create, rack cards, he said, so that people know that you treat certain illnesses. And that was never how I practiced. I did not treat illnesses. I treated people and helped people find their way to health. And so I rejected his suggestion and I found my way to do it the way I knew was right for me. That's my mom and I on my graduation day. So let's talk about some beliefs and myths. And if you are watching this presentation, perhaps you've already downloaded my guide to the 10 beliefs that I feel we need to change around our health. So we have quite a few beliefs. One of them is that the doctor knows best. There's only one way to health. Health means certain lab numbers. If your lab numbers are within the range that they have for those particular tests, then they call you healthy. It's a one size fits all. And there's a general sort of suggestion that science is smarter than our own intuition. Clearly, I disagree with that. This is my best girlfriend and I doing one of our favorite hikes. This picture is obviously a little bit older. And so for women, it's a different experience. I've seen this time and time again. So historically, we are taught, or the insinuation is that women are weaker. Our health is more fragile. Our menstrual cycle makes us weak. We don't have as strong of muscles. We can't do as much. We can be hysterical. We have less stamina. And I always say, have you ever seen a woman in childbirth? And then you get to menopause, watch out because women are out of control. These are the beliefs and myths that have been put out there. Women are often seen as dramatic. Women can act crazy. We're seen as emotional, that our emotions drive us, and that our emotions are unreliable. Well, I'm here to tell you that this is not the right way to look at women's health. So we're separated. There's men on one side and women on the other. But in reality, I love this, it was never addressed. We really are powerful human beings. And we just have to give ourselves permission to use that power. Historically, that we're told that general medicine applies to all women. We're told that science speaks for all, women and men. And most importantly, diseases are seen as separate from us. They're seen as something to be conquered. Whereas I believe that diseases give us information about ourselves. There's a very patriarchal way of thinking. There is, historically, there is a belief that Mother Earth is more dangerous and that the God in the sky is all knowing and that God is generally male for most beliefs. Men are wise, men have more authority, women should be subservient. There's been this planting of a seed of this type of thinking for many, many years. So it's important to know a little bit about the history of medicine in the US, and I'm just briefly going to touch on this. In the late 1800s, medicine, doctors most people could call themselves a doctor. There was, the training was not really standardized. So in an effort to set standards for the medical education, there was actually a report that was commissioned by the FDA, although the FDA did not want to be known as the ones commissioning this report. It was called the Flexner Report. John D. Rockefeller is actually the one who provided the funding for this. And John D. Rockefeller had a lot of money in the petroleum industry, which then links to the pharmaceutical industry. And the standardized medical education then became all about what we call allopathic medicine, which is your medical doctors, and holistic medicine, which had been practiced for hundreds and hundreds of years, was seen as not reliable because it was not based in science, which was actually not true, but that was sort of the theory and the standardization that happened at that time. And you can look up the Flexner report and you'll find interesting information about it. So that's real, where things turned. There was a change at that point. And then let's talk about pharmaceuticals. Now, don't get me wrong. There are absolutely times when drugs are important and useful. But the philosophy behind pharmaceuticals is the important piece to know. The philosophy is to conquer the bug or the illness. It's like stopping a process versus fixing an issue or healing. For example, we have antibiotics, which are called against the bacteria, biotics. So they're really used to kill the bacteria. Antivirals treat the virus or kill the virus. Anti-seizure medications, antidepressants, anti-anxiety medications. There's a lot of antis. Illness or disease is seen as something to be conquered. And so these drugs have to be really strong and powerful to make that happen. But symptoms are a way of communicating that your body is out of balance. So healing in pharmaceutical medicine is not the goal. Alleviating the symptom is the goal. And so they tell you, take this drug to fix this issue, but does it really fix the issue? Now, don't get me wrong. Again, steroids, for example, thank goodness we have them. They save lives. When there's an anaphylactic reaction, an EpiPen is the best thing you can have. They stop the anti-inflammatory process, and at times that's really important. Antidepressants lessen feelings of sadness, but when you stop taking the antidepressant, those feelings come back. So the actual issue has not been healed, it's just been stopped. Same with anti-anxiety medications. It will reduce the symptom of anxiety, but it doesn't solve whatever it is that caused that anxiety. Basically, we've been putting a piece of tape over the check engine light. So how do you evaluate and identify a chronic health problem? First of all, you want to figure out what system is involved, and it could be multiple systems. For example, if you had a digestive issue, digestive issues can present as stomach discomfort, heartburn, reflux. You might have constipation or really loose stools or alternating. There might be a really low appetite. Somebody might have a lot of gas or bloating. If there's a cardiovascular issue, there could be blood pressure troubles, palpitations, high cholesterol, swelling in hands and feet. People might have fainting. I had a patient recently who had some fainting spells, and we put a heart monitor on him and discovered he was having heart arrhythmias. There could be hormonal issues. These are my dogs tugging over a toy. The reason I put that picture there is our hormonal system, which includes our thyroid, our adrenal glands, and for women, our ovaries, and for men, their testes. Those three organ systems, hormonal glands, all work as a team. And so if one is out of balance, the others are trying to balance the triangle. People might have thyroid issues, adrenal issues, menstrual issues, menopausal issues. There could be urinary issues like incontinence or leakage or frequent bladder infections. There's a condition called interstitial cystitis that I've treated with many women. That's very uncomfortable. There's burning. There are a lot of issues in that system. Now, if we're looking at the skin, somebody might have rashes. This was actually a squamous cell carcinoma that I had to send a patient to a dermatologist for. People have really sensitive skin. They might have acne or extreme itching or redness. Then there are blood disorders like anemia, people who bruise easily, bleed easily. There are several cancers of the blood. Then you have your skeletal system. Now, there are many women who have osteopenia or osteoporosis. I've worked with patients who have bone infections and breaks in bones that just do not heal, or have had bone bruising and real sensitivities. There could be muscular issues, might be muscular pain or multiple sclerosis, muscle cramping, weakness, muscle injuries that just won't heal. Excuse me. Then we have our lymphatic system. excuse me, where people might have skin changes or swelling, infections, and there are a whole host of lymphoma and other types of cancers associated with our lymphatic system. There is the reproductive system. This is a robin who had built her nest right outside my living room window on a ladder I had out there. And there's her eggs from last spring. You know, we could have women have endometriosis. They could have uterine fibroids, polycystic ovary syndrome, various sexually transmitted diseases that they have left, you know, constant issues with. Herpes virus is a common issue that women have struggles with. Then we have respiratory issues like asthma and emphysema, chronic obstructive pulmonary disease, tuberculosis, lung cancers. There are neurological issues like headaches, epilepsy, strokes, Lou Gehrig's disease known as ALS, Alzheimer's and dementia, Parkinson's. Neurological issues can actually affect the digestive system as well. And then there are immune system issues and autoimmunes like rheumatoid arthritis and lupus, inflammatory bowel disease, multiple sclerosis, diabetes, psoriasis. So I say to people, you know, what systems are you having issues with? And it is often more than one, because we are a working machine. We're not just one system that works on its own. And these systems are often interrelated. So it's in order to identify and evaluate a chronic health problem, we really have to ask, what symptoms are you experiencing? Symptoms that many people experience, women especially, that are often disregarded in women are energy, low energy. I cannot tell you how many times I've met women over the years who say, I just don't have the energy I think I should have. Or sleep issues. I don't sleep enough. I sleep too much. I can't sleep through the night. Mood struggles, you know, anxiety is through the roof these days, depression. There are so many mood issues that people struggle with, headaches, and there are several different types of headaches. People who experience weakness and don't know why. There might be physical pain like joint pain, muscle pain, people who feel achy all over. I had a patient about 5 years ago. I'd been seeing her for several years, or she'd been seeing me for several years, and she came to me one day in December and had this pretty recent sudden onset of joint pain in her hands and her knees. And she was a yoga teacher and lived a very healthy life. And I said to her, I think you might have Lyme disease. Well, she did not agree with me because she didn't spend any time outside, so she couldn't understand how that could be. So fast forward a year and a half later, where she had worked with 2 different rheumatologists who had given her a slew of different medications. And they finally said to her, we can't help you. We don't really know what is going on. So she came into me one day shaking uncontrollably. And I said, we are testing you for Lyme disease. And we did the real proper testing, because there are good tests for Lyme disease and not so good tests. And sure enough, she had Lyme disease and several co-infections. And now we see some progress in her health because we knew what we were treating. People might have digestive issues, you know, bloating or discomfort, gas. There are all kinds of menstrual issues, and these are often disregarded. Anxiety is often disregarded by the medical system. So I want you to think of a health challenge you have struggled with, and how is this problem limiting your life? And what treatments have you tried? So now let's talk about your part. So I always mention to people, we have to talk about you being fully awake versus being asleep with your health. This is myself and one of my dogs taking a nap. You know, being really awake requires knowing your body. It requires being truly honest with yourself, noticing the changes and paying attention to when the changes started and acknowledging your habits. I have many women who say to me, don't take my 1, 2, 3 glasses of wine away from me at night. And those same women are often the ones that have interrupted sleep. And we know that when we drink wine late at night, it affects our blood sugar, or even in the evening, it affects blood sugar, and blood sugar plummets and we wake up in the middle of the night. So you have to really be willing to be awake about those issues. So there is, you know, there are habits that we fall into. And a habit is defined as a settled or regular tendency or practice, especially one that's hard to give up. The problem with habits is after a while, we do them unconsciously. And so we have to really become aware and acknowledge what is it that we're doing that could really be affecting us. So I always ask people, what is the goal you have with your health? Do you just want to alleviate a symptom? Do you want to identify the underlying cause? Do you want to change your future? You really have to decide, what are you willing to do to make, and what changes are you after? And then what is your role with your health? Like, how committed are you? What can you do? What will you do? What won't you do? It's really about becoming honest with looking at all the aspects of your health. And I know this, I've seen it in my own health, and I've seen it in hundreds and hundreds and hundreds of patients who I've worked with. I've seen people who've changed their diets and had chronic health issues resolve. I've seen people who figured out how to live their life differently and their health issues got better. So now let's talk about that. Let's talk about temperament. So temperament is an individual's physiological and psychological traits that are innate. They're not learned. Genetic traits determine your physical characteristics. Epigenetic traits, which you've heard a lot of recently in the healthcare field, determines the functional and physiological characteristics. So temperament are your innate traits. They're the basis of your psyche, but they're not your personality per se. So how do you react psychologically? How well do you metabolize different foods and vitamins? This is all part of temperament. So there are 4 basic temperaments. There's choleric, melancholic, phlegmatic, and sanguine. So I'm going to put these in context of the characters from The Wizard of Oz. So the lion, he was the choleric. And the choleric person has a lot of courage. They're a really strong leader. They're hot-blooded. They really are, like, they're the leaders. They really are, they really have a lot of energy, and they lead by vision, you know, they're a bit dominant when they're out of balance. And then we have, so if we go to the right, we have the melancholic nervous. That's the Tin Man. So the Tin Man was very creative and passionate, and he wanted to get in touch with his heart. But the melancholic people are a little bit more private and responsive, and they can be very, very creative and passionate, but when they get out of balance, they really can struggle with being efficient and like focused. Then you have the phlegmatic or lymphatic people, and that's Dorothy. Dorothy was very childlike, very inquisitive, but she was also rebellious and very dedicated. And when the phlegmatics get out of balance, they can be spiteful and petulant, and they're really all about responsibility and being like heart-centered. And then you have your sanguines, and the sanguines is the scarecrow. So the scarecrow is really stuck in being silly. They're the really funny, goofy people that make people laugh. And they can be more assertive and proactive. A sanguine can be associated with the male aspect, and but they can also be very argumentative. And so what does that have to do with health? Well, believe it or not, each of these different temperaments does better by different sleeping patterns, by doing certain types of exercise, by eating certain foods. And there are tests online. You can Google temperament tests and figure out what your temperament is. And we all have a little bit of everything. I always tell people, you know, you're not just one thing 100%, or most people aren't. But through the temperament test, you could find out what your predominant temperament is. And then there are ways to support that so that you stay healthy. So let's talk about treatment options. Particularly, what type of practitioner does what and who can help you? Now, in this day and age, there are a lot of treatment options out there. There is allopathic medicine, which is your medical doctor. Allo means other, so they use antibiotics to treat the disease. There's naturopathic medicine. Naturopathic doctors, we treat the cause. We really look for the cause instead of just treating the symptom. There's osteopathic medicine, which uses some physical medicine in their treatments, chiropractic. There's health coaching, nutritionists, massage therapists, acupuncturists, and there are many different types of all of these practitioners. Ayurvedic medicine is a wonderful form of healing. Energy therapies, Reiki, and many other types. Homeopathy, hypnotherapy, herbalism, physical medicine, mind-body medicine, and many of these different types of practitioners use several of these types of treatments. So it's really important to figure out, how do you choose the best treatment option for you? And really to add to that piece, when we're choosing the treatment option, it's important to know what is important in when you're working with a practitioner, what's the important part for you? Do you want someone that is a great bedside manner? Do you want someone who is all business? It's really important to know what's the best connection for you. And then how to be successful. It's important to figure out what you will do, what you won't do, and really who will support you and who will sabotage you in your life. I have had patients who have come in and they say, well, I'm doing all the right things, but my partner or my family tells me I'm not going to succeed, so I feel that I can't succeed. And then finally, it's so important that when struggles come up, you have to have a backup plan, because let's be honest, life is never a straight line. There are ups and downs, and it's really important to know what you're going to do when you're struggling with those challenges. So I'm a huge believer in Mother Earth. I really believe that we are connected to nature and we can learn a lot from nature. I always say to my patients, we heard that famous saying, starve a cold, feed a fever. Well, I disagree with that. And I'll tell you why. When you watch your animals and they're sick, or any animal who's sick, when my dogs get sick, they don't want to be outside playing and pushing themselves and digging holes and doing the things that they do when they feel well. They sleep and they eat less. They are allowing their bodies to heal. And I really believe and know that nature teaches us the best way for our bodies, which are part of nature, to heal. So these are, the stories that I wanted to share with you. And the reason I wanted to get this information out is I've just seen so many women struggle. They go to the doctor doesn't listen. So I want to give women some skills and really help women feel empowered. So I've created this special program. It's called Take Back Your Health. It's a 6-week program to support you on the path of truly being in charge of your health. I'm really passionate about helping women accomplish this goal because I've accomplished it in my life and it has changed my life. So I want to invite you to join me in this journey to take back your health. So it's a 6-week program, as I shared. And when you finish this program, or during the course of it, you're going to feel empowered to really take charge of your health so that you're an active participant and not just a passive bystander doing what you're told. I want to help you increase the awareness of the life changes that you can make to feel better mentally, physically, and emotionally. I'm going to help you discover how to feel centered in yourself so the world can't knock you down so easily and you can follow the healing path that really is right for you. And you're going to experience aha moments that will help you to begin to shift your habits so that you can be more in control of your health. I have spent the last 20 years as a doctor and 30 years overall in healthcare watching women realize the power that they have. And you are going to walk out of this program feeling that power. We will help you create your personal roadmap to guide you towards your optimal health. You're going to learn how to connect and listen to your body Intuition is a really powerful tool, and I love to teach women how to really work with their intuition. You're going to gain awareness of the many choices that are available and decide how to move forward with your health and what choices to make for you. And we're going to help you determine your best support system so that your experience is positive and really shuts out the naysayers. So the Take Back Your Health program, all sessions will be recorded, is going to happen on 6 Wednesdays at 6 p.m. Eastern Standard Time. And again, all sessions will be recorded, but it is an interactive program. So it's great if you're able to make as many sessions in person as possible. And so the class format, I'll probably present for 30 or 40 minutes, and then we're going to have a discussion to really flush out what fits for you and how you can move forward and really learn how to take care of your body in a more positive, natural way. So there are going to be 6 modules. Module 1 is the evolution of medicine. We're going to really learn in depth. I shared just a little piece with the Flexner report. We're going to learn starting from the time of the Greek gods, how we got to the medicine we know today. We're going to really differentiate between holistic medicine versus conventional medicine, which is something called green allopathy. We're going to talk about really realize the difference between what you can do versus what you can take. You know, even in the holistic healthcare field, supplements and vitamins seem to be the magic answer, but there's so much more that you can do to really take charge of your health when you know what your own body wants. In module 2, we're going to really identify your health challenges, and discover the difference between a symptom and an underlying cause. You will explore the different systems of your body and how to know what system is really the struggle. And you're going to determine more clearly whether your struggle is more mental, physical, or emotional. And it can be more than one. In module 3, we're going to talk about the standard and alternative testing options. So you'll understand the options available in traditional lab testing, the options available for alternative testing, and how to choose or request which test or tests are right for your concerns. In module 4, we're going to really talk about accessing and trusting your intuition. Identifying the difference between intuition and fear is an amazing skill to have. And I'm going to teach you that and discover how to know if your intuition is really speaking and learn how to stay grounded when you're faced with choices and doctors that feel intimidating. In module 5, we're going to talk about how to choose your team. We're going to learn about the different types of doctors and practitioners and really figure out which one is right for your health concerns. And then we'll help you determine the qualities in a nurse or a doctor or a health practitioner or a healer that are really vital to your journey. And then finally, in module 6, we're going to determine the steps that you're going to take, start to lay out your roadmap to get to health, and create a plan for what you will do when you lose focus or come up against obstacles. In addition to the 6 weeks, I'm going to offer as a special bonus a 30-minute phone consultation where we will talk about your roadmap so that I can help you find your way to the path that you're looking for. And I'm going to teach you a few meditation techniques. So all of this is going to be 2 payment options I've offered for this program. A single payment for the 6 weeks is $767, or if you wish to do it in 2 easy payments, that's $427 for each payment. And here is the link to the program, and by watching this presentation, you'll have access to the link if you'd like to sign up and join me. And I really hope you do. It's been my privilege in my life to really watch women take charge and change their lives. It's to watch somebody feel that empowerment and really feel that they can move forward and they know what to do and they know how to speak to their doctor and feel sure and clear about their own journey is a really amazing experience to participate in. So I thank you so much for joining me. We won't be asking questions now, and I wish you the best.